Hello, everybody. Welcome. I'm Julie Carter, Professor Emeritus at Oregon Health and Science University, and I'm just so pleased that everybody is here attending our fourth session in a four-part series for care partners of people with Parkinson's disease. I just want you to know that this has been it's our first series, very successfully done over the year, and if you have any interest in attending prior sessions, they are on the WPC website, so feel free to access them. I think there'll be something for everyone if you're interested. Before I really get started, I'd like to just say one thing about this really very stressful time we've been in. It's hard for everybody, but I know it's doubly hard for people who are care partners. And I say that because when you're a care partner, your support group networks, other people in your life, all those things are so important. And this forced isolation that we're all experiencing is hard on all of us, but I know it's even harder on you. So I just want you to know that we at the WPC are here for you. We want you to reach out if there's anything we can do. We want to be here to help you. You can access our hotline. We have many programs online. Just call us. We're here for you. With that, I want to just say that we want you to be healthy and happy, both physically and emotionally. And this session is very apropos for that very thing. So with that, a couple of housekeeping things. One, I want to remind all of the listeners that you come from a huge spectrum of places, both physically, experientially. We have many. This is directed primarily for care partners, but there are also people with Parkinson's disease, many healthcare professionals, physicians, nurses, social workers, rehab specialists, and even a few pharmacists. So some of you are very new to this disease, and some of you are very experienced with this disease. So as panel members speak, some things may be very familiar to you. Know that to somebody else, it might be brand new information, but no matter where you are, there will be something we have to offer you. So thank you for your understanding about that. While our panelists are speaking, you can ask questions. Just type in your question, and we will be answering the bulk of those at the end of these talks. But I probably will ask each panel member one question at the end of their talk. With that, I want to start by welcoming our panelists. There is 4 panelists today. The first person is Dr. Silke Cresswell, who's a movement disorder specialist and a neurologist at the University of British Columbia. Lissa Kapust, who is a clinical social worker and a wellness coordinator at Beth Israel Deaconess in Boston. 2 very talented and wonderful speakers. And then saving the best to the last, we have the real experts in this disease, Leslie and Steve Peter. They're a couple who live with Parkinson's disease, and they will also be sharing their wisdom. So I'd like to also thank our sponsors, Supernus Pharmaceuticals and Adamas Pharmaceuticals. If we did not have these 2 sponsors, truly we would not be able to do this program. So with that, I'd like to start by introducing Dr. Cresswell, and she will be discussing healthy living and well-being for care partners. Silke?
Thank you very much, and thank you very much for having me. It's such an honor. So a very warm welcome to everybody who has joined today, and I will indeed review healthy living and well-being for care partners. Well-being really is about the whole person. Physical, emotional, cognitive, social, spiritual aspects really who we are. And my main message today really is that it is absolutely crucial for care partners to make room for their own well-being. This can often seem like a challenge, and many care partners even might say they're feeling guilty for on the surface really putting themselves first. Yet it is really more important now than it ever has been. If you think about this analogy on the airplane, that you're always told to put the oxygen mask on first. This might be an often used image, but it is absolutely true. You just cannot provide loving care when you're running on empty. So first message is throw all this guilt out of the window. And now I'm going to discuss a few of the lifestyle and behavior changes that have evidence to actually be beneficial. So exercise, of course, has to be first. There's a quote saying that if exercise was a medicine, it would be the most prescribed medicine on the planet. And I think it is actually really difficult to overstate its power. It has so many positive effects. So for heart health, risk for diabetes, for healthy weight, for bone density, and then, of course, for the brain. In the brain, it can generate new cells, it can improve blood supply, it can lead to better sleep, to reduced inflammation. We know it reduces low mood and anxiety. Yeah, and there is actually even evidence that it might protect against cognitive decline and dementia as well as Parkinson's, in addition to all its other benefits. And of course, in Parkinson's itself, exercise is really one of the pillars of treatment. So that's a great one, and obviously there are many different kinds of exercise, and it's really crucial to find something that gets your heart beating a bit faster and that strengthens you, and most importantly, that you enjoy. Next up is healthy nutrition. So for example, Mediterranean style eating patterns. So that would be a mostly plant-based, lots of fresh fruit and vegetables, seeds, nuts, olive oil. There's even a little bit of red wine and in moderation in there, whole grains and animal protein from fish and poultry, so chicken, rather than red meat. Red meat should actually be avoided, and equally bad is processed and fried foods. Sweets should only be eaten in moderation and in small amounts, and as really as treats that they are supposed to be. Unfortunately, our typical Western diet, which is very meat heavy, red meat heavy, lots of processed foods, lots of white flours, leads to inflammation. It can lead to high cholesterol levels, to high sugar levels, and eventual diabetes. And quite interestingly, actually, the Mediterranean type diets have been shown to halve the risk of dementia and Alzheimer's disease. And it has also been shown to reduce the risk of Parkinson's. And we just got a paper accepted actually last week, where we showed that in people who already have Parkinson's, those who ate more closely aligned with the Mediterranean type eating style, they got the age of onset of Parkinson's was much later. So it was about a decade later. And for women, this effect was even more pronounced. For women, that was between the third that adhered most closely to those eating patterns compared to the third that didn't. The women got their Parkinson's disease 17 years later. Now that's 1.5 decades of not having Parkinson's. So I think nutrition is really going to be quite a point of research, and is because there are really no side effects, something that everybody should embrace. Mindfulness and other techniques of stress reduction and really improving spiritual health is very useful. It can, as mentioned, lead to stress reduction, but also to just better emotional health. The same meal tastes so much better and is so much more enjoyable if you eat it in a mindful way rather than actually looking at a screen at the same time and not even really noticing what we're eating. creative and cognitive pursuits. So we when we came on this morning, we talked about music and making music together, even if it is remote right now. Learning an instrument, singing in a choir is actually fabulous. It's really good for your brain. It engages many parts of the brain. Obviously, it engages the auditory, so the hearing parts of the brain. But if you're reading music, also the visual parts, the movement parts. You need cognition and concentration. You're multitasking. It can have a very positive influence on emotions, and it fosters all these connections between those different brain regions. Depending on what you're listening to, you can either calm yourself down or you can get yourself really energized. And there are good studies to show that when you're listening to music that energizes you, you'll also be exercising harder. So there's a dual benefit. The one thing to say is that what one person really enjoys and calms them might be completely irritable to another. So make sure you have your own personal selection and maybe a playlist for doing exercise and a playlist for the holidays and a playlist for calming down and meditating or working or cooking. There are really endless possibilities. Being in nature, now you see my background here, it's of course virtual right now. It's one of the urban parks we have in Vancouver. Being in nature is actually really beneficial too. It can reduce stress levels, it can reduce anxiety, improve mood, improve creativity and cognition. Those are short-term effects if you just go for a walk in the park, literally. But you can also get long-term effects, and there have been studies done, particularly in Scandinavian countries, that really show that across the board for psychiatric conditions in children, as well as for cognition and even brain size. And then the other one is social connectedness and community, being part of a community. Absolutely crucial for us as humans who are such absolutely social creatures, for our happiness and also for our physical health. It literally is true that loneliness kills. So there is a study run out of Harvard, running for over 8 decades, and it found that being lonely, that feeling of not having as many contacts with other people as you would like, is as dangerous as smoking or drinking irresponsible amounts of alcohol. And that then was expressed in terms of survival. So it really has a huge effect on us. And obviously, this is particularly true during today's time with the pandemic and social distancing. So I'm particularly pleased that you're all online, because that really is our best way to stay in touch right now. So keep that going, even though, of course, we all look a bit flat right now. Another one is to really make time to address medical issues early. Don't skip those screening visits. Don't skip your own doctor's visits. Address things like high blood pressure, diabetes, problematic alcohol consumption, any smoking or high cholesterol early on. Hearing is another one that really is important to address early on. And it actually has been shown to reduce the risk for cognitive decline and for dementia if you address hearing issues early on. So make time for yourself, and that includes making time for those doctor appointments. And what I found really, really encouraging as somebody who is interested in the prevention of neurological disorders, as well as, of course, their treatment, is that previous studies suggested 30% of all dementia is probably preventable. And it now looks like that it's probably even 60%, incorporating all these different things that I've just told you about. So in addition to the short-term benefits for your health and for your happiness, there are really also very powerful long-term reasons why you need to make this an absolute priority. Your health matters. Making your well-being a priority in everyday life is a necessity. It is not a luxury. And if you can then pursue those healthy strategies together with your partner, well, even better. And with that, I'll give it back and thank you again.
Thank you very much, Dr. Cresswell. I will ask you one question, and and save the rest of the questions to the end of all the presentations. But so you did discuss some really good strategies, but I'm wondering if you could expound a little bit more on how strategies to translate some of these theories into practice.
Yeah, absolutely. That's where the rubber hits the road, right? I mean, we all know cognitively that this is what we should do, but another day has gone by and we haven't done it yet. So I do think it starts with the absolute conviction that this is something you need to prioritize. It has to be there, put it into the calendar. It has to be also as easy as possible to do. So you got to set up your environment for it. So maybe you have a little exercise corner, you have the healthy food at home. So you have a fruit bowl, let's say, on the table rather than tucked away. You might wear your exercise clothes because it's easier to actually get going. So reduce any hurdles that might be there. That is one. Make it as pleasurable as possible. So if you really enjoy dancing, well, then do dancing rather than going for a run if that is something that you absolutely do not like. So make it fun. If you can do it with somebody or at least be accountable to somebody, that really helps to adhere to it too. So as mentioned, if you can do it together, fantastic. Be very specific. When are you going to do this? Where are you going to do this? What exactly are you going to do? With whom? And have that in the calendar so that it really takes priority.
All right, thank you. There'll be more questions about some of these things later on. So now I'd like to introduce Lissa Kapust, who is as I mentioned, a clinical social worker, and she's going to be talking about the care partner journey, a marathon, not the 100-yard dash.
Thank you. While Dr. Cresswell had us in a beautiful Vancouver park, I'm going to invite you to come with me to Boston. Now, I know that's an odd invitation for the winter, but for the next 10 minutes, please join me at the Boston Marathon, and I'll explain why. It's really, we're gonna start at the start line of the marathon, which is in Hopkinton, Massachusetts. And this is where the historic Boston Marathon begins. I'm really using this as a metaphor because care partners are like marathon runners. From the moment your family member heard the words, "You've got Parkinson's," you were transported to the marathon start line. If you're a runner at the start line, you will stretch, make sure you're hydrated, and you'll study the route. And you'll have a positive attitude. You'll say, "I can do this. I am strong." Marathon runners, again, have studied the route, and they know that in the Boston Marathon, at 20.5 miles, begins Heartbreak Hill. The finish line is just 6 miles away, but the brutal hills at Heartbreak Hill can end the marathon for runners who haven't conserved their energy. Self-care and proper pacing are essential for care partners who want to make it to the finish line with their physical and emotional health. And I do know that this is a theme that you're going to hear throughout the day. In this talk, I'm going to highlight a few challenges and strategies that have the overarching theme of planning, pacing, and learning to ask for help. But first, I have a question. In other arenas of your life, how do you pace yourself? Are you a sprinter? Maybe you're a slow and steady plotter. Do you tend to plan or procrastinate? There really aren't any right or wrong answers on this. It's really a matter of style. Decision-making starts at the point of diagnosis for your loved one. Think back on how you handled key decisions. How and when did you share the diagnosis? Importantly, how did you make this decision? Did you give the person with Parkinson's control over this? What if this conflicted with your own needs? If the person with Parkinson's wants to keep the diagnosis a private matter, this can leave the care partner feeling isolated, keeping a secret, unable to get important needed support. This crossroad can be an important opportunity for you and your partner to have an open discussion, sometimes with the need for compromise. There will be times when your own needs can be on the front burner. In a similar way to how you share the diagnosis, think about how you get information. Do you like to read everything you can, search the internet, or is your style to get bite-sized pieces of reality? Maybe you like to learn on an as-need-to-know basis. The fact that all of you are here today says a lot about how you search out opportunities to learn. Figure out what works for you. There may be times when you feel oversaturated with webinars, seminars, and medical appointments, and you just need some time off. That's okay too. Recharge your emotional batteries and then come back to the task at hand. How about lifestyle choices? Are you continuing to work? There's no one-size-fits-all approach. You may wonder how you can continue to work if your partner's needs increase. Many view work as their own therapy. Your income from your job may be important to maintain your lifestyle. When adaptations are needed, modify slowly. Perhaps you can cut back your work hours and make job adaptations that fit your new circumstances better. Do you maintain a social life? While this may be challenged by COVID, don't neglect important sources of social support, as well as hobbies and interests that keep you going. Find creative ways to keep in contact with those special people who can be your trusted listening ear, a confidant. In this marathon, you'll need to establish a good relationship with your partner's health care providers. Partners may feel left out of discussions with the team, and this can be frustrating. Can you put your needs on the agenda during a visit? Your perspective about your partner's situation is important. I wrote a blog some time back for the World Parkinson's Congress called It's Showtime. The blog captured a phenomenon described to me by care partners. Here's how it goes. When their partner with Parkinson's goes to the neurologist, the behavior can be dramatically different than what's experienced on a day-to-day basis at home. The care partner may be concerned about their partner's apathy, soft voice, cognitive changes, or shuffling gait. But at the appointment with the neurologist, the person with Parkinson's perks up, speaks more loudly, walks with bigger steps, and states, "I'm doing fine." The care partner can be in a quandary about how to share a different view without demoralizing their loved one. You can do this in a thoughtful and caring way. Mid-stage themes for care partners center around the need for adaptation. Using the metaphor of the marathon, watch out for Heartbreak Hill. Several years after the diagnosis, the challenges can feel greater. The wear and tear theory of caregiving has merit. As time goes on, the care partner can get more emotionally and physically worn down. Safety issues can arise at this phase. The care partner may have to confront the issue of when is it time to stop driving. This can be a decision that brings family members to their knees. Driving cessation becomes a marker that life has fundamentally changed, and normal activities and routines must also change. When the loss of driving is needed, there are losses for the person with Parkinson's, but also for you, the care partner. Becoming the designated driver may not be what you wanted, but it may be what's needed. A driving assessment program can be a valuable resource in addressing this important question. Some individuals maintain driving skills for years after the diagnosis, but this is an area where the consequences are great if you wait too long. Another safety issue is falls. Fall risks for the person with Parkinson's, they're clear. However, in this symposium, in this webinar, I ask you to think about how falls can also be a safety risk for you. In an effort to prevent a fall for a loved one, 2 people can go down with injuries for both. Similarly, the care partner who tries repeatedly to get a partner out of a chair can put their own health at risk, causing back pain or other strain injuries. Your well-being matters. You are the other part of the equation. Get help to preserve your health. Moving is another issue that care partners can confront. When is the right time? There are no cookie-cutter approaches to this difficult decision. Are you a planner or a procrastinator? Get help in making this decision from trusted family members, a healthcare team, a realtor, or a heart-to-heart discussion with your partner. When first thinking about a move, themes of loss predominate. It can be overwhelming when all you consider are what you're leaving behind. But what you can't always know is what you'll get on the other end. Maybe it's being closer to adult children, grandchildren. Perhaps it's leaving a dangerous situation in an older home with lots of steps. Or maybe it is a move where you can have easier access to services with less isolation. A frequent question after a successful move that I hear is, why didn't I do this sooner? And now some thoughts about later stage considerations. It's important to maximize resources to get to the finish line. Consider these topics for yourself. And our prior speaker highlighted these. Health maintenance. Have you delayed your regular health appointments? You probably make sure that your partners don't miss their appointments. When was your last physical, dental appointment, or visit to the optometrist? Spiritual needs. Who and what are your sources of strength? Identify them and rally them. For some of you, connecting with nature, again, as we heard with our other speaker, that may be where you get your strength. That's how you get through tough times. For others, it may be prayer, music, singing, choirs, or a mindfulness practice. Don't cut corners on feeding your soul. And I will end with the importance of self-compassion. This is not the time for perfection. What would you advise a friend who is in your situation? Some days you will struggle more than others. Plans can be changed, modified, and rethought. Finally, a Buddhist belief that is worth remembering. Here's how it goes. If compassion doesn't include yourself, it is incomplete. I'm going to say that one more time because I just love it. If compassion doesn't include yourself, it's incomplete. You will manage the marathon. I heard a recent review of a popular new children's book. It's called The Boy, the Mole, the Fox, and the Horse. It's a book of hope for uncertain times. The boy asks the horse, "What is the bravest thing you ever said?" "Help," said the horse. "Asking for help isn't giving up," said the horse. "It's refusing to give up." I just ordered my copy of the book. It would make a great holiday gift or stocking stuffer. I hope my ideas have been helpful. Thank you.
Thank you, Lissa. That was wonderful. I do have one question before we move on. This is sort of you've given a lot of wonderful sort of inspirational and philosophical thoughts for us, but this is more tangible. And this comes from a spouse who says her husband just shouldn't be driving anymore. She sees dents in the car and she won't ride with him anymore. And yet he won't stop driving. Do you have any words to help her know what to do next?
Yeah, those dings and dents in the car are definitely a red flag. Other red flags may be if the person with Parkinson's is getting lost while they're driving. If you can find a driving assessment program, that's really the best option. That takes the decision-making out of your hands, out of the neurologist's hands, and it really gives the person with Parkinson's an ability to have what we call their day in court. I coordinate one of these programs up in Boston, and I know what an incredibly important role they can play. Sometimes the person with Parkinson's can actually engage in a discussion about this. And you might be surprised to find that your partner actually says that there are times where they are, in fact, themselves quite scared behind the wheel. So it may not be the struggle that you think it will be. And if you find that discussion doesn't move you forward, turn to your neurologist. There may be other family members that can help. Sometimes appealing to the person's goodwill, that they've always done the right thing throughout their lives, and the concern how terrible it would be if they hurt themselves or somebody else while they were driving. When all else fails, you might need to take an authoritarian stance and remove the car, since keeping a car in the driveway when a person is no longer safe actually may act as a magnet and become a real problem. But since this is a Care Partners Symposium, I really ask that you think about what your needs are and how to get support for yourself as you're negotiating this really complicated decision. I hope that helps.
Thank you. Now we're going to turn to Leslie and Steve Peter, and they are going to be talking to us about how they manage wellness beyond medication. And we'll start with Leslie, who's going to be talking about some of her tips.
Thanks so much for having me. I think one of my biggest tips is that you need to find support. Caregivers need as much support as possible, not only through having written and website resources, but also through having people as resources. The one-on-one contact is so important, and connecting with people that are going through the same things that you are going through can really help alleviate the feelings of isolation. I'm always happy and willing to talk to anyone that is struggling. I know what it's like, and I want to be there to help any way that I can. It's really important that you take care of yourself. 4 important things to focus on that were highlighted by Dr. Cresswell are proper nutrition, getting enough exercise, and even though I struggle with this, getting enough sleep. Another thing that is hugely beneficial is practicing mindfulness or meditation. Caregiving is physically and emotionally exhausting, and including mindfulness in your daily schedule gives you a chance to reset. Taking care of yourself ensures that you will be able to take the best possible care of your partner. Make time to do something that you love. It doesn't have to be something that is too time-consuming. If you're concerned about being away from your partner, it just needs to be anything that you can focus on for short periods of times. One of my guilty pleasures is reading. It helps me to get lost in someone else's story for an hour here and there. Thinking about the future. Steve was misdiagnosed for several years and just received a definitive diagnosis in 2013. Since that time, I've maintained my role as a care partner, knowing that at some point I will transition into the role of caregiver. Right now, I try to be Steve's cheerleader. Steve's apathy can get in the way at times, so I really focus on encouraging him to stay engaged and to exercise as much as possible. Helping Steve maintain his positivity is one of my goals for the future. As of now, focusing on his health and his full-time job, and I remind him of that often. I plan to use my current strategies for self-care throughout my entire journey with PD. The Parkinson's Foundation has so many resources for caregivers, and as the stages of Steve's disease change, I will continue to seek guidance. As you all know, things can be difficult to juggle at times, but I believe maintaining good communication for as long as possible is also key. When I find things overwhelming, I put on my headphones and walk on the treadmill. Listening to music while walking helps turn my mind off for a bit. As Steve would be the first to say, it aids in giving me a little bit of an attitude adjustment. Ways to support caregivers. For anyone tuning in that is looking for ways to support a primary caregiver, listen, spend time with the caregiver. Do something for the caregiver that they wouldn't normally do for themselves. For example, giving a gift certificate for a massage or a facial, or just taking the caregiver to lunch would be a treat. Everyone is focusing on how the patient is doing, and it's easy to overlook the caregiver. Also, people tend to lose touch, and a lot of times it is just because they don't know how to help or what to say. Lastly, support further research by making a donation in the caregiver's name to a foundation that focuses on making life better for people with Parkinson's. My message to caregivers would be to take things one day at a time, because sometimes looking at the whole big picture can be overwhelming. I have a favorite quote by Professor Joseph Campbell. We must let go of the life that we have planned so as to accept the one that is waiting for us. Know that you are not alone. We are all in this together.
Thank you, Leslie. That was very wonderful. So I have a question for you. And this is a personal question. Through the ups and downs, do you have any strategies for staying motivated? To be positive, to be healthy?
I think what keeps me motivated is knowing that the more proactive we are and the more educated we are, the better Steve's outcome will be. So that's kind of what helps keep, I think, both of us motivated.
Thank you. And so now we'll turn to Steve, last but not least, and he's going to be talking about his tips for wellness.
Thank you. I was diagnosed with Parkinson's in 2013, as Leslie said. However, I was misdiagnosed with essential tremor for several years prior to that. I had DBS in 2015 and changed my life. My care partner is Leslie, as you know. We refer to each other as care partners because her care is as much my responsibility as my care is hers. Exercise has always been an important part of my life. However, definitely not as important as it is today. As we all know, exercise is the only thing that slows the progression of PD, so it's so important. I've always loved it, but it's so important to find something that you can really latch on to. I've always loved hiking, and since we live in Colorado, it has been an enjoyable pastime for my family and I. My interest in hiking led to me finding an organization in Spokane, Washington called Pass to Pass. Pass to Pass has several hikes every August that raise funds and awareness for Parkinson's disease. Each hike is approximately 30 to 50 miles, and it consists of 12 hikers. Half the hikers are people with Parkinson's, half the hikers are support hikers. The team also includes llamas that carry the majority of the gear. I train all year long to be ready for August, and I really feel that giving yourself a goal can make the day-to-day training less daunting. And at the same time, shows your partner you are willing to fight. My son Noah is a support hiker and has brought us very close. We all know Parkinson's sucks, but finding things to be thankful for helps. As I stated earlier, my wife and I refer to each other as care partners because no matter what is going on, our care is each other's responsibility. I do, however, realize that my care can be more complex and cumbersome than her care. I also realize that Leslie never stopped thinking about my disease and our future. I try to keep a positive attitude and never forget that Leslie's care is as important as mine. I encourage Les to do things that she enjoys and try to take as much off her plate as I can. My family is what motivates me and to keep me healthy and strong as possible. And my big takeaway for this little speech, if you want to call it, is that each other's care is so vital to each other. It's a two-way street. She takes care of me, I take care of her. But she has a bigger load on her. And so we need to take care of our care partners.
Wonderfully said. Thank you, Steve. So one question specifically to you, and it relates to your very impressive exercise regime. And I know you're human, so I'll ask you this question. What do you do when you hit a plateau or a wall in your training?
Which I do pretty often. I try to change things up. Maybe part of changing it up is I take a break, and instead of going to so much treadmill, I'll do more bike or something like that, but kind of keeping it as flexible as possible. I mean, everybody has an interest that goes so far. And if you're walking five times on the treadmill a week for 5 miles at a time, like it's kind of boring. So you got to change it up. Maybe it's going for walks outside more when it's nice out with my dogs, or like I said, biking, or maybe it's just taking a break. But keeping it flexible is what works for me.
Thank you. So now I'm going to turn to some questions by many of the listeners. And the first one is going to be for Dr. Cresswell. And actually, there are a number of questions about nutrition. So I'm going to put 2 of these in, and maybe you can address both of them. One of them is about the Mediterranean diet. And this listener is saying that that they understand the benefits of the Mediterranean diet, but they didn't think there was any evidence to support that in Parkinson's disease.
Yes, so excellent question, of course, and that is a very crucial point. Now, how much evidence and how much benefit do you get when somebody has a diagnosis of Parkinson's? And how much is the Mediterranean diet useful in preventing or delaying Parkinson's and other conditions, obviously? It is absolutely right that there is much more evidence for the prevention or delay piece. And that is why I, of course, also stress that today, since we're talking to the care partners who, by and large, would not have Parkinson's themselves. So it's a good idea to start doing that in, midlife for sure, best, of course, throughout your life. There's one study that also shows that these same kind of eating patterns, it wasn't called the Mediterranean diet, but by Dr. Michelli, showed that similar eating patterns actually were correlated with a positive effect on, or with slower progression, less symptoms. Now, because this question is so crucial, we are just applying for funding to set up a randomized controlled trial to test that very diet pattern in a as blinded as possible way. So we're hopefully going to run a randomized controlled trial with people who already have Parkinson's and see what the potential benefits are for Parkinson's itself once you already have it. So the verdict is out.
Thank you. I want to just add one more nutritional question. This is a more practical question, which is, you understand this. You understand all the good benefits of certain diets, but how do you change your diet, especially if you are not the cook?
Yes. So if you're not the cook, that could, of course, be something where you could even start. Maybe you could share that little bit. Maybe make prepare 2 meals a week or so as a start, and then you could increase that. I think it starts with a conversation at home. It starts with shopping what is actually available in the house, what you're likely to snack on or not, and humans, we're creatures of habit. If something is easily available and right in front of my nose, that's what I'm going to eat, particularly if it has high, what we'd call reward value for the brain, right? If it's fatty, sugary, and kind of hyper triggers us compared to, let's say, kale. And my husband would have something to say about that. There are apps that you can use. There are plenty of fantastic cookbooks that you can look at. There are lots of recipes online. There are programs like teaching kitchens where you can take courses currently also online on how to do healthy cooking. We have our brain wellness program here that we run currently online, where we're going to do cooking together, and we're just setting this up so that people can cook and eat together and learn how to do it. So I think there are actually quite a few resources, and it is about the long run. This is not just a short-term diet of 3 weeks, but it's making those long-term food choices, and it will take a while to actually get used to that and develop a new taste in a way. But every little incremental improvement you make will be useful. So don't do it overnight, but just do it bit by bit. Make a concrete change this week, and then once you've got that down in 2 weeks' time, or in 3 weeks, you can make another change.
Thank you. And maybe some of the names of the cookbooks and the apps we can list in our program notes or resources afterward. If you could share those, that would be wonderful.
Yeah. Sure.
So the next question actually is for both Leslie and Lissa. And this one is about concerns about the emotional concerns for their Parkinson's spouse. Do you have any suggestions from a professional and also an experiential viewpoint about how to respond best to the emotional ups and downs of your spouse with Parkinson's disease? And Lissa, why don't you go first? Yeah.
Well, I think that's a complicated question, because I think it depends on how have you always communicated? How did you communicate in the past? And if you communicated in an open kind of a way, I think that transparency is important, and really trying to understand and not guess what's on the mind of the person with Parkinson's, but to ask them about that. In many centers of excellence there, I'm a clinical social worker, so I definitely have a bias, but my practice includes working often with couples so that we can facilitate the conversation around how partners can support one another, which harkens to Leslie's talk and Steve's talk as well. So I would say just really trying to understand and not assume what's going on. Sometimes people can say communication is difficult if the individual with Parkinson's has kind of a constricted affect or face that doesn't move very freely. So it can look as though they might be upset or angry, but in fact, that may not be how they're feeling. So trying to, again, just transparency, talking and relying on the kinds of communication that have always worked best for you as a couple. I guess that'd be my recommendation.
And I would say keeping lines of communication open, making sure that your partner knows that they can talk to you about everything. I know as a caregiver, I have, worries, and I know as a patient with Parkinson's that Steve has his own worries, but just trying to really keep lines of communication open and kind of nipping it in the bud. I know when Steve, tends to, seem to isolate or have, worries where I can tell something is bothering him, I really try to be patient and just, let him know that I'm here for him to talk to.
Thank you both very much. This next question I'm going to pose to Steve. This actually, and actually Leslie too, this is from a care partner, and this person is saying that I am finding that mental health challenges of depression are really interfering with my spouse's well-being, and he has less desire to exercise and engage in activities. Do you have any tips for or steps to address the depression or the apathy?
Is that to me?
We'll start with you, yes. Mm-hmm.
Yeah. Well, I mean, definitely, Leslie points out she says that being apathetic was one of the first signs of my Parkinson's. I'm sure it was. I guess the best way to become non-apathetic is set goals. And it sounds kind of silly and maybe simple, but set goals for yourself. And not everybody's in the same physical shape as everybody else. So maybe your goal is walk around the block 3 times. Maybe your goal is walk around the block 1 time. Set goals and build on those goals. Is my best way, is the way I beat apathy. And I challenge myself every day to do something, but I look back at my life and I realize that those challenges are kind of silly compared to what I used to be able to do, but they're not. So, I mean, little challenges build up into one big goal, I guess is the best way to say it.
And Leslie, so, I mean, Steve has really described his internal motivation, but when you're on the outside of this person you love and you see this, do you have any pearls of wisdom about that?
Well, I think depression is, something that all of us probably, struggle with mental health issues. And it's important, obviously, to talk to your partner's movement disorder doc. A lot of men, and I know this from experience, tend to feel like they do not want, they don't acknowledge depression. They don't want to feel like they need to take a medication, that it, is a sign of weakness. And my husband's movement neurologist disorder doc actually really helped us with this by saying, Parkinson's is a chemical imbalance. And sometimes you need a chemical to help you, to help you be at your best. And Steve, it took a while, was finally receptive to that, and now takes, a small dose of an antidepressant, but I think it helps. So obviously, talking to your doctor to see if that is an option, might be something to consider.
Mm-hmm. Dr. Cresswell, do you have anything from a physician's point of view to add?
Yes, I certainly feel rather passionately about that. So first of all, really it is talking about it openly, bringing it up with your healthcare team as well. It is a symptom, as are other neurological symptoms, that often results from these messengers in the brain being imbalanced. And with levodopa, we're replacing one of those messengers, dopamine, but that doesn't actually affect the other messengers yet. So antidepressants are therefore useful to balance those other messengers as well, which are equally affected. So this is really absolutely important, and I think it speaks to the bigger discussion of just really getting rid of the stigma of mental health issues. They're incredibly common with and without Parkinson's. They have an enormous impact, if not the most impact, on quality of life, both for the person living with Parkinson's in this case and the people around them. And I think it is just absolutely important that everybody, be that people living with Parkinson's, care partners, the healthcare team, just have that on their radar, left, right, and center, and always check for it. And if it is present, address it proactively.
Thank you. So I'm going to address this next question to Lissa. And I think this is a very, very important question, which is about Parkinson's disease, maybe life in general, but it's really profound in Parkinson's disease, is a constant situation of change. You finally get something down and then things change. This care partner is asking, how do you prepare for and create the happiest outcomes as we approach and experience a new norm, basically?
You said the really hard one.
Anybody can add to this because it's a profound
No,
question.
and I think there are multiple perspectives probably on this. It's a little bit, if you just concentrate on crossing the finish line, that may not be the real goal. And maybe, as in running a marathon, you have to kind of appreciate things along the way. So I guess the question is, how can you be in the moment? And sometimes I'll say to a care partner that I'm working with or a person with Parkinson's, today is December 9th. How can you make this the very best December 9th that you can have? This is what you've got in front of you. So I think that, you got Parkinson's disease at the core, but around the core, there are edges that are malleable, and we can shape those, and we can influence that particular day, trying to think about how you celebrate the moments that you've got to celebrate. I think the COVID pandemic has added yet a whole other layer that puts us all in such a state of uncertainty. So certainly care partners often don't know, day to day, hour to hour, how things will be. But I think in general, as a society, we're all struggling with such uncertainty, such difficulty in making a plan. So what was pretty specific to Parkinson's and care partners, to a certain degree, has universalized as we're all really challenged to try to figure out how to be in the moment and how to appreciate really the blessings that we have at that particular point in time.
And sometimes it's helpful just to name it, isn't it? We're dealing with something different than we've been dealing with. And when you name it, sometimes it's easier to come up with strategies for coping with it. We are really close to the end here. I'm going to ask just one more question that's across a number of these, which is about motivation and motivation about exercise, especially from the care partner's point of view for the spouse who isn't doing some of the things that they think they should do. And I think I'll address this to Dr. Cresswell in her work in wellness in her own community. What kind of advice would you have for care partners?
Yes, so I'd say, again, make it a team approach. So find your tribe, find other people who are in a similar situation, and so you have the support of the community to live in a culture where this is just what everybody does, and where you can check in with each other, whether you've done your exercise goals today yet. Making it easy, so reducing any barriers that might be there, and making it as fun as possible, making it attainable. So rather than starting with a marathon, just start with 10 minutes of exercise. From a community, so that's the care partner perspective, and from a community perspective, so we set up a program that is online so that we create community doing the exercises. So when we do exercise, people also get to socialize afterwards, and there's music involved and so on. So you kind of bundle these things that are necessary with things that are joyful. And you might say, okay, I love my whatever it is that you really like, cup of tea or something. Before I sit down and drink this cup of tea, I'm going to do a 10-minute walk or something like that, or do a set of exercises. So really bundle it with things you enjoy and set it up for easy access.
Perfect. Thank you. Now what I'd like to do, each of our panel members, first of all, thank you all so much. It's wonderful. Have one take-home point, which they would like to share with you. And I will start with Dr. Cresswell.
Yeah, so really, I just repeat, making your well-being in everyday life is really a necessity, not a luxury. So find your personal way to look after your own spiritual, emotional, physical, and social health, and make it a priority.
Lissa.
Care partners need to pace themselves over the course of the illness. They need to balance their needs with those of the person with Parkinson's. It is like running a marathon, and the goal is to have the care partner cross the finish line with preserved emotional and physical well-being.
Leslie.
Again, I would say take things one day at a time, because it is overwhelming to look at the whole big picture. No one knows what tomorrow holds, so you just need to, do your best to live for today, and know that you're not alone. We're all in this together.
And Steve.
Well, like I said before, care partnering is a two-way street. We have to remember we need to take care of the people that are taking care of us, because their needs are just as important as ours, and ours are probably more cumbersome and more complicated, but they're just as important.
Thank you. So in closing, again, thank you all for being here. I want to thank our panelists who have given their time generously and thoughtfully to be part of this session. And I want to just bring your attention to the fact that to please to the survey button. If you take the survey, it's not long, but it helps us planning our future sessions. So please give us any input you have about the session itself, about individual speakers, things you'd like to hear about. We will be announcing our 2021 series, and that's going to happen in January. So once again, I want to thank our sponsors. We would not be doing this without them. And be sure and tune in for our 2021 series. I will tell you that the overarching theme is going to be about self-care. We talk about self-care all the time, but really how to achieve self-care, especially in the face of all the emotional and just environmental obstacles we have, can be a real challenge. So with that, I'd like to say thanks again, and we hope to see you next year. You won't want to miss it. Sorry.